It is a huge honor for me to be podcast interviewing Sheri Doniger. Sheri, thank you so much for being on my show today.
Thanks, Howard. It's an honor.
Sheri is a leading dental clinician, author, educator, and consultant who currently practices dentistry in Lincolnwood, Illinois. An avid researcher, Dr. Doniger frequently contributes to a variety of dental publications on topics ranging from clinical practice to effective communications. Dr. Doniger currently writes columns for drbicuspid.com entitled Sheri Solutions. Dr. Doniger is a prominent advocate for mentoring and is a voice within the industry for enhancing ergonomics in the practice lives of women dentists. As a health and wellness advocate, Dr. Doniger presents internationally at many conferences where her topics often center on team, ergonomics, and women in dental industry. She is an active member of numerous professional societies, including the ADA, the Illinois State Dental Society, Chicago Dental Society, and the American Association of Women Dentists, as well as being a fellow in the American College of Dentists and International College of Dentists. Dr. Doniger is currently serving as the immediate past president of the American Association of Women Dentists. Most importantly, Sheri is a wife of 37 years to Robert Pollyea, a mom to 2 adult children, and grandmother to Brianna and Owen. So I see you're wearing a Chicago Cubs shirt. So when you met your husband 37 years ago, was that the last time they won the World Series?
No, the last time they won the World Series, neither of us were born yet. I think that was in 108 years ago. But the last time they were in the World Series was in 1945. And interestingly, we are a mixed marriage, Howard. I don't know how to describe this, except my husband is actually a White Sox fan, and I am a Cubs fan. So it's sort of been an interesting rivalry throughout the years.
Huh. So they're tied right now 1-1, right?
Yes, they are.
And
yes,
what's your now that we're capturing you live, what is your prediction for the outcome?
My prediction is they're going to be very happy in Wrigleyville on Sunday night.
Is that right? Well, I know they're going to be.
I think right now we have home field advantage. We have to win 3 more games, and we've got Friday, Saturday, and Sunday at Wrigley. And I think they're going to be dancing in the streets on Sunday night in Chicago.
So is the American Dental Association officially a White Sox fan or a Cub Sox fan? Or a Cubs fan?
Ooh, that's a good question. That I don't know. They're sort of, well, you know what? They're sort of in the middle geographically between Wrigley Field and I don't know what they're calling White Sox Park anymore, but it's Comiskey Field to me. It's been that way forever. So I think that's what it is.
Well, the true winners are the bars that are charging $500 a table to watch the game.
Yes, you believe that? Is that insane?
We picked the wrong profession.
We both picked the wrong profession. I'm kind of hoping that they're taking this money and putting it into a charity somewhere, maybe building a school or I don't know, giving homeless people meals. I have no idea, but it'd be nice just to think that they'd be a little altruistic with all the funds they're going to be making. And you aren't even touching on the parking, Howard. Parking as a minimum is $80 anywhere near. On a normal game day, it's $25. It's $80. And I'm guessing that they'll be closing the periphery. I don't know if you saw any television the other night, but they'll probably be closing the periphery at the 7th inning around Clark and Addison. The other night, there were 300,000 people. They're expecting 500,000 people tomorrow night in that area.
Wow. You know, whenever you fly back from New York or something, when you fly by that Chicago at 30,000, 40,000 feet, that is so huge and beautiful, and the way it wraps around the lake. That is one of the most beautiful cities to fly over. You know, if there's
it is.
Yeah, crazy beauty. You know, before we start on, I asked you if Doniger what that was, and you were telling me it's Irish, but you said there's a DNA test from Google. What were you saying?
There's a very interesting test. It's 23andMe, and the woman who started this is the wife of one of the Google founders.
Sargey Brin or Larry Page?
Not Larry Page, the other.
Sargey Brin's the Russian, and Larry Page is the Wisconsin cheesehead.
No, it's definitely the Russian. And
Okay, Sarge's wife.
yes, it's his wife. And what you do is you expectorate into a test tube, and they assess your DNA. And they're not going to tell you what day you're going to die, but they may say that you'll have a propensity for kidney issues or heart issues, or but the one thing that they will tell you is what percentage of anything you are. And I happen to be 99% of one. I happen to be 99% Ashkenazi Jew. And I forgot what the rest of it is, but my husband has a varied background of the places that he was from. The other interesting part about 23andMe is my husband was adopted. And just as many people our age, adoption records were sealed in those days. So the only way he really found out about his family was through this 23andMe. And as he found out about his family, which was really pretty fascinating, he first did the test before I did, and he wound up having a cousin contact him. And the cousin knew aunts and relatives and things like that. And these aunts put this woman in contact with his brother, 2 brothers. He actually has 3 brothers. He was given up at birth. And the woman who was contacting, her name is Dawn. Dawn had contacted Bob, and then Dawn had called up the brother in California and cold call. Imagine getting a phone call on a Saturday morning saying, you have a brother, you have to take the spit in the tube test and find out if you're really his brother. And he did, and they are, and they met each other, and they're making up for 60 plus years of being separated. And he met his other brother, and the one brother he hasn't met yet. But this 23andMe is just fascinating, especially for adoptees who are looking for relatives in their family and people that just want some answers. And I said, it's not going to tell you you're going to die on Thursday, but it does really give you some very interesting information.
Wow. Well, you just sold me. I went to 23andMe, 20 numeral number 2 3, then spelled out andme.com, and I'm gonna absolutely do it for me and my 4 boys. I'm a little nervous though because I was born and raised in Kansas, and I'm just afraid they might find some farm animals in my DNA. Some goats, chickens.
Maybe not. You know, my husband has a little, I think, Neanderthal, or his brother has some Neanderthal in there. It goes all the way that far back. So you'll have to keep me posted as to what you find. It's kind of interesting.
Well, actually, that's a new development about the Neanderthal. So, you know, when we were in school, they were telling us that humans left Africa about 68, 70,000 years ago, and that was the modern theory. But people really didn't understand how there was so much diversity from like someone in Korea to Ireland in just 70,000 years. And now they found out that an earlier group left 2 million years earlier, and those are the people that populated the whole world. And then a second group came out 70,000 years ago, and 70,000 years ago there were 5 different types of humans, just like there's, you know, multiple different types of cats, tigers, lions, pumas, all that. There are 5 different types of humans. And then at the end of the day, Homo sapien won. So yeah, so you see people that are 4 to 6% in Europe, Neanderthal, Peking man, Cro-Magnon. So yeah, we're all part cavemen.
Yeah, it's fascinating science. It's fascinating science.
So I wanted to get you on. I called you. You didn't call me because you're the past president of the American Association of Women Dentists, and I'm very sensitive to this because I grew up with 5 sisters, and my mom, bless her heart, you know, she put me in jeans and iron patches on the outside, and I had no curfew and could swim in the river. And my sisters were put in dresses, and if they soiled their dress, they were in trouble. And I just saw so much gender differences in our culture. And then when I went to dental school, the senior class had 1 woman. And now it's half the class are women. But as a man, I don't feel like I have any authority to say, are there any women's issues in dentistry? Because it almost sounds sexist to even ask the question. You know, that'd be like you saying, you know, how can you do a root canal without any hair? And, you know, I couldn't imagine a dental magazine, a bald dentist association, you know, just short, fat, bald guys talking about how hard it is. So are there special issues for being a woman in dentistry?
Well, you open up a very interesting question. The biggest issue when I was in school was just getting in. As you said, there was only one woman in your class. In my class, there were maybe 30, and I think we graduated 25. I don't know how many of the ladies in my class are still practicing, but that is one issue. There is an interesting issue that I sort of did a little bit backwards, and it's women in their careers have a lot of starts and stops. Dentistry is the best profession. Howard, you and I can both scream from the rafters how dentistry is the best profession in the world for anybody, but especially for women. But women tend to have a lot of starts and stops in their careers. They have to take care of their children. They get pregnant. They have a little stop that they, take some child rearing time off. Now, I think that the younger practitioners are taking a little bit more child rearing time off. As we get older, we may need to take some time off for our aging parents. There's all sorts of reasons to stop practicing, to start practicing. I did it a little bit differently. I was pregnant in dental school. We got married right before dental school started. Actually, we eloped. That was a whole nother interesting story.
You got married in dental school?
I got married a week before dental school. We drove up to Canada and got married in Canada.
And you got pregnant in dental school?
I was pregnant. Yes, sir, I was. I was pregnant, right?
I thought you said earlier you were Jewish. You just, by saying that means you're Mormon. If you had a baby in dental school, I can get you official license from BYU. You're officially now a Mormon.
Right.
Forget what the DNA test says.
Okay, well, I'll have to go back and look at my test and see. But not only I was pregnant, and then I was pregnant senior year as well. So I had my kids very early, and so I enjoyed my kids when I was a little bit younger. But I started dental school a little bit later, and but a lot of times with these young moms, there's a lot of starting. You have to go home for childcare. You have to go stop and see every play. So that is one concern about the starts and stops. The other thing is, a long time ago, I don't know if it still is now, but just the acceptance factor of being a female practitioner. I had people come into the office and say, well, where's the dentist? And I said, well, I'm the dentist. Well, no, you're not. You're the hygienist. And I said, well, yeah, I was a hygienist too, but I'm really the dentist today. So I think that acceptance issue is pretty much gone. But the biggest factor in women is ergonomics. We are, for the most part, and have been using the same equipment that's been around forever. Handpieces didn't change that much except over the last couple of years. The weight of the handpiece, the heft of the handpiece, the instruments, the fulcrum, the hygiene instruments were a little bit of a different story because I would say about 99% of hygienists are women. And so the hygiene instruments were pretty much always made for a woman's hand, but a lot of these things were not made for women's hand, even dental stools. There's definitely a difference in sitting in a stool that's created more for a woman's posture and legs and seating position than it is for than it is to sit in one of those little round donuts that we did when we were in dental school. But ergonomics is a big factor. And I think that, when you talk to manufacturers about this, it's not just making, appealing to women in the marketplace to, make it softer. It really needs to conform our bodies. Our bodies are shorter, our hands are shorter, everything is just a little different sized. So I think that ergonomics is another big issue that women do face. And one of the other aside issues is, just speaking about the marketplace, is how the manufacturers kind of look at women. Making something pink doesn't always need to be directed to women. So if you made a pink handpiece, it doesn't mean that, it's not definitely, okay, we're making a pink handpiece, you should be able to use this because you're a woman. No. We're looking at a lot of technical information. We're looking at weight. We're looking at, fulcrum. We're looking at a whole bunch of other things. And for manufacturers just to make things pink is not really solving a woman's ergonomic issue. And I think that's where the industry is right now. They are working very diligently about making things that are fitting women better, from loops to stools to even working with overhead lighting. I think the industry is really coming along. Well, they have to, because as you said earlier, 50% of the women coming out of dental school right now, 50% of the students coming out of dental school right now are women, and over the course of the next several years, 100% of about 80% of all offices are going to be 100% women. Because when you consider the women practitioner, the office manager, who is usually probably about 98% female, unless somebody's husband is, sitting in the chair, the front chair. The assistant is about 99% female, and the hygienist is about 99% female. So we may be envisioning women are definitely the new norm in dentistry.
Did you know my dad's brother Mike was the first male registered nurse in the state of Kansas?
I did not. That's awesome.
And you know why? Because
Why?
when he graduated from high school, Aunt Shirley still hadn't gone out with him yet, and he was so distraught that he was never going to see Aunt Shirley again. He found out she signed up for nursing school, so he signed up right behind her. And it took till
oh my God,
it
that's
took
a great
till
story.
junior year of nursing school before she finally went on a date with him, and then she married him right when they graduated. And even that shows how sexist it was back then, because not only was he the first male, but when he got out of school, every hospital offered him the director's position. And then, and he was like barely passed. And then his wife was a 4.0, and she could only find third shift on weekends.
Well, it hasn't changed that much on certain things, Howard. I mean, look at the number of women in leadership roles, especially in the ADA, and look at the women, even just going out of dentistry. The women producers, the women directors, the women writers, the women in Congress, forget all the commercials that are going on now, just the representation. So yeah, we're getting there though. We're getting there.
Now your children, and you have 2 children, 2 grandchildren.
Yes, I do.
What percent of those are boys and girls of your grandchildren? Brianna and Owen. Brianna's a girl?
Brianna's a girl, Owen's a boy, and I have my daughter, obviously, who had the kids, and which you would not have known that, because it could have been my son's daughter, and then my son. So I personally have a girl and a boy, and we are blessed to have a girl and a boy as grandchildren.
They say you should never ever talk about religion, sex, politics, or violence, but I have to make an exception because I have a granddaughter, Taylor Marie, and I just have to say that raising 4 boys was so different than being raised with 5 sisters, and I voted for the female president on my write-in ballot because I don't want my little Taylor to see that every president, 44 out of 44, were a boy, and then she realizes she's not a boy. I mean, I selfishly did that just for Taylor. Do you think that was wrong, or do you think that's crazy? Or, I mean, you're the past president of the Women's Dental Association.
I think it's the time of the woman. I think it's time for women to show their ability and their capability in leadership. And no, I think it's awesome. I think that all of the rhetoric aside, I think it's just so great to be able to have a woman at the head of the ticket to show women that, yes, you are not just going to get the third shift midnights, or you aren't just going to be, never going to get past the secretarial pool. I mean, of course, that was the Mad Men era, but I think I think you did a very wise selection.
Well, I can still remember my dad had 9 Sonic drive-ins, and I always worked for him, and I didn't have any brothers at the time. My little brother wasn't born until I was 17. And I can remember in 1979 cooking a Sonic cheeseburger, and the radio saying that England had just elected its first woman president, Margaret Thatcher, the prime minister. And I can remember all of my dad's friends at that moment thinking, I mean, they looked confused. They said, what the hell would they do that for? And then another man, it was, what was his name? It was Cliff Williams, or said, I thought that was a really smart country. I mean, they were stunned. And then it turns out she was like the Iron Fist, the Iron, what do they call her?
Right.
The Iron Woman, and stood
Right.
up to the unions and the coal miners and Falkland Islands. So yeah, I mean, I've lived through, like my little brother was born gay as a $3 bill. I mean, at 3 years old, if you didn't know he was something between Liberace and Elton John, you're from another planet. I mean, I knew he was gay 10 years before he did. And at that time, I mean, it was quite acceptable to leave mass and then joke that last night you went to the park and beat up gay people. And now, a generation later, they're getting married legally. You know what I mean? So I've just seen some of these titanic shifts. But yeah, I voted. I was a single issue voter. It's like, I don't want my granddaughter seeing anything. I want her seeing that she can get the top job. That she wasn't born missing something. I want to go to another a 4,000-pound gorilla question. A lot of these younger women look at you and they say, you're lucky. You graduated in the fee-for-service indemnity insurance, and you just submitted your fee, and Delta paid 100% of the cleanings, exams, and x-rays, and 80% of restoratives, half the crowns. Now, my generation, we're graduating from school, and the insurance companies are sending you the fee schedule, and it's 40% less than the fee schedule that they sent you 20 years ago. I mean, I used to charge $1,000 for a molar root canal when I got out of school, and Delta paid 80%. Now the fee given to me is, $600 to, $600. So the question I'm asking you is, when you look at overhead, labor is the largest overhead, about 28% for dental offices. And the second largest overhead, even though it's not on an accounting P&L, is insurance adjusted production of, taking your fee schedule and adjusting off the PPO schedule. Most offices are adjusting off about 25% of revenue because 82% of dental offices take PPO. So that was a long-winded question to say, what do you think about PPOs?
First, I would like to correct your vernacular.
Okay.
And I would like to say the dental industry does not have insurance. The dental industry has a benefit. And I have been discussing dental benefits for over 40 years. And you and I have been practicing for a while. I think that when dental benefits started, there was a $1,000 maximum. And you're right, back in the day, $1,000 bought a lot of dentistry. Now, dental benefit companies still have the same $1,000 maximum. If you're lucky, you'll find 15. And that doesn't buy hardly anything. And what I tried to explain to my patients to have the education and to just even talking about a PPO is saying that you are given, you work for a company, they give you a specific dental plan. This plan is a defrayment of expenses. It has very little to do with insurance, as if you would go in for a hip replacement and they would maybe pay, you'd be paying a couple $100 for this hip replacement. And whereas in dental, they don't pay, you have to pay a lot more. I think that a lot of these I think a lot of patients need a lot of education. I also think that it's a fairly bold move for people not to be participating members. And that is what I advise my young female or male dentists that come up and talk to me. I understand that it's attractive, and I understand that, you think that you're making so much quicker, but you went to school, you have a lot of education, and you really need to sit back and look at the quality of your life and the quality of work. And I'm not saying to go out and buy like a Tesla tomorrow, but you want to look at the quality of your life and how you want to be looked at by your patients. And a lot of people, myself included, I know there's more people now that aren't even taking any dental benefit in their practice, but I do take dental PPOs, and I think that I will not take a dental HMO, but I do take a dental PPO, and I just flat out explain to the patient, these are my fees, they're fair fees, and I expect that you will pay the remainder balance of what your dental benefit is going to give you. And again, go into the education and say it's just a little bit of money that they're giving you to defray the expense of any dentistry that needs to be done. And to tell a young person that it's kind of a hard sell. It really is. But I think I'd rather be in this situation. I don't want somebody telling me how much I have to produce. As a sole practitioner, I think the biggest reason I went into dentistry was to be a sole practitioner. And I don't want to have somebody to tell me how much to produce and what to do and what plans I have to participate in and how much we have to charge and what we're getting and et cetera, et cetera, et cetera. So I think we just have to sort of stand up to the PPOs and say, I get it, and tell the patients that this is what they have to pay, and hopefully the younger practitioners will be able to move into that direction, to be able to keep the sanctity of a private practice.
So Sheri, you were saying that you always wanted to be a solo practicing owner. You wanted to own your own show. But then earlier you said that being a female has a lot of start and stops because of kids. You're probably talking to a lot of women dentists right now, thousands of them under 30, commuting to dental school or work. And what if she's driving to work thinking, well, maybe I should go get a job at corporate at Harlan or Aspen, or because I want to have 2 kids. And when I have a kid, I might take off 6 weeks. What would you say to her about, can solo practice meet her goals of start and stop as well as working for one of the big box corporate chains?
I truly believe it can, because I believe that there's a model out there where several women can get together and have a practice, 2 or 3. And some people like to work in the mornings. Like I like starting at 7 o'clock in the morning. So I start at 7, I'm done at 1. Young parents with kids that are in school, they have to have a different time schedule. So they can have staggered schedules. They can have staggered days. Offices are setting up daycares in their own practice. I know practices that have daycare, just that have an operatory that isn't plumbed for an operatory, but they have their caregiver in the office and they can have their baby there while they're still treating patients. I think that there's some models that can be done, and I've heard so many negative things. And Howard, I don't know, how you feel about these corporate clients, but I've heard so many things about physical injuries that these corporations are basically putting on the young practitioners because they have to produce so much and have to work so much and are winding up in this pretzel contortion shape, because you know how we don't sit how we're supposed to sit all the time anyway correctly. And there's a lot of physical ailments, back, neck, shoulder, and a lot of expectations. And I get that there's, for somebody to throw a carrot out there and say, look at all the money that you're going to be making, and you're going to get a vacation, you're going to get this, you're going to get that. I think if it's planned well enough, I think people can start there to kind of get an idea of how to run a business, because I think that is another thing that male, female, that people are woefully undereducated in. I actually have a book that's going to be coming out. I didn't put this down on my info sheet, but I have a book that's going to be coming out on practice management, because I think that we just don't get enough practice management in school. But I think if somebody went into one of those corporate plans for a couple of, maybe a year, just to kind of get an idea of how to run a business, and then go into 2 or 3, not necessarily group practice, but just a sharing practice, to be able to share space and rely on somebody else and say, Howard, I'm going to be gone for 6 weeks, and you take my schedule, and I'll take your schedule for when you're going to be gone for 6 weeks. I think it'll work. There actually is somebody out there that does talk about that says, you go away for 6 months in the summer, and you have Dr. Farran take over your patients one week, and Dr. Belitz take over your patients for another week. Sometimes the patients don't even know you're gone. So I think it can be done. I think women are motivated. I think women are clever and smart, and I think it can be done to be your own individual sole practitioner, run your business, and also have an awesome life.
It's funny when everybody thinks about corporate. I mean, you and I have been around the block a few times, and we this is round two for us. I mean, when we got out of school, Orthodontic Centers of America was consolidating the ortho industry, and there were a dozen on NASDAQ, and every one of them imploded. And then they were gone for 10 years, long enough for everyone to forget, but Wall Street didn't forget, because this new round of corporate, notice not one of them has been publicly traded, because they only grow their revenue by growing debt. If they want to add $1 million of revenue, they go buy another practice for $1 million. That's not a sexy balance sheet. But I think that I would give the same grade to all of dentistry. There's 211,000 dentists, and that is, I want you to talk about this, that nobody keeps their patients for life. I mean, you go find a dental office that's been 10, 20, 30, 40 years in a town of 5,000 that's had almost no change in population, and 40 years later, they want new patients. If a hygienist worked 40 hours a week, that's 2,000 hours a year. She could only clean 1,000 people's teeth for an hour and then bring them back in 6 months for another hour. And at 25 new patients a month, you'd be adding 4 hygienists a decade. Yet you come back at the end of the decade, they still just got 1 hygienist. And into 2 decades, they still got 1 hygienist. 3 decades, they still got. So nobody, I don't care if it's Aspen or Heartland or the dentist across the street or the best dentist you know, nobody is keeping their customers. So what I want to ask you, to these young dentists that are starting out, what do you think they could do differently than all the dentists and corporations that came before them to actually keep their customers for years and years and come, and someday to be treating their customers' kids or grandkids? How do you keep customers for life?
I think the biggest thing that you keep biggest way in my mind that you keep customers for life is giving them good service, is customer relations. My dad sold life insurance. And when you talk about people not staying, my dad worked in the insurance industry for over 40, probably 50 years. And he kept many tons of his clients for life. And he always said to me, it's about service. And if you treat your office, I have a very, and Howard, you said something not even 2 minutes ago that if I could kiss you and hug you, I would right now. But what you said was you give hygienists an hour. There's so few dentists that give hygienists an hour. I personally have a mantra that I have an hour for every one of my patients, if they need it or not. I want to have the communication. I want to spend time with them. I want to get to know them. I want to hear about the vacation. I don't want to just go in and start doing number 13 MOD. I want to be able to have a relationship with them. And I think keeping patients for life, or for as long as they possibly can stay, because there's life changes. People get married, they have benefit changes, they need to be transferred to a different city, they move locations for whatever reason, they go to college. But you want to be able to develop a relationship, so when these people do go away, they eventually do want to come back. And I think a lot of it has to do with listening, and a lot of it has to do with you being personable. I mean, we've been wearing these Cubs outfits all week long. My patients thought it was hysterical. We were normally in scrubs, very professional. Here we are, we're dressed like, Cubs fans all week long, because it's like, it's the news in Chicago. And I think that just has a lot to do with it. Focus on the service, not on the business. If you focus on the service and the customer care, patients will stay. And in dentistry, even though it is a business, can't look like a business to your patients. And that's the one thing that I try to stress with every single person I talk to, that yes, dentistry is a business. We're all trying to make money. We're trying to, we have teams that we have to support. They have families that they also have to support. So this isn't a charity, but we also have to think about who's coming into our office and the body and the mind that's around all those teeth. We have to really take care of them and cultivate those relationships.
Okay, I want to ask you another question. This is the most common questions they're asking on the Dental Time message boards as they come out of school. I believe that every single graduation class since they built the Great Wall of China complains that they didn't learn everything they needed to learn in dental school. So they walk out of dental school and they say, I didn't do any ortho. Should I learn short-term ortho Invisalign? I didn't place an implant. Should I go learn how to place implants? We didn't do CAD cam. Should I go buy a CEREC machine? I didn't learn sleep apnea, so I learned. And they got $350,000 of debt. They see all these shiny objects, lasers, CAD cams that are six figures. They see these courses that are $4,000 a weekend, and they want to be the best, but it's very expensive, very overwhelming. Where would you tell them to start for a return on investment? Do they need all the shiny objects? Do they need to be able to do every procedure from A to Z?
I think when I was pretty blessed when I got out of dental school because I was a hygienist before I was a dentist. So I had a lot of chairside experience and I knew, hygiene obviously pretty by rote. I think the biggest thing is focus on the basics. And yes, it's so important to be able to say I can do this and I can do that and I've got a CAD CAM machine, but it also depends on where the young practitioner is going to be. If they're going to be in somebody else's office, they'll have a mentor. And the most important thing for them to do is to be able to find mentors in different areas, just to see who's big on sleep apnea. And it doesn't have to be necessarily taking a course. It could be somebody locally that they could just ask questions and answer, go to study clubs, just Dental Town. I mean, let's talk about a great mentor site, just to be able to hear other people's opinion. And if I were to say to somebody, what is the one most important tool besides the basics, digital x-rays and sharp hand instruments and a great dental assistant and getting speed up during the course of your early learning years, I would say one of the biggest investments I would recommend that's portable would be an intraoral camera. I think when patients see what's in their mouths, because this dance with the mirror and the hand mirror that's like 19th century. So to be able to say, let me show you what I've got, what you got cooking in there. Every new patient we have, we take a picture of their lower anterior linguals. What a great picture. I didn't know I had all that. You got to look at that all day long. Yeah, we do. But more important, let's see how we can get your mouth to better health. So I think an intraoral camera is a great starting point. I know everybody's interested in, making a lot of money fast. If people see what is in their mouths, they're more interested to A, having a conversation, and B, exploring treatment. So that would be my recommendation. But as far as, taking an ortho class and doing this and doing that, my other recommendation would be get a little bit of information on practice management. And if you're in a corporate world, you learn that from corporate. If you're in a huge group practice, you'd learn that from the people that you're in a group practice with. But again, it all boils down to getting a mentor and having somebody that you trust, either a faculty from dental school or a friend in an organization that you're in or a study club, or even in your Dental Town, you can always follow somebody very specifically if you really love what they're writing about and love their style, and and people are open to having conversations. So I think in this connected world, I think it's a lot easier to find mentors and get answers and kind of work your way through, well, what do I really need to do? But again, going back to the basics, focusing on getting skill, being very comfortable for patients to come into your office, them not having any fear or any pain, and awesome communication and service. I think that's so important. Get those down first. The rest will come.
Well said. And the mentor is so more important because they seem to ask technical questions like, well, I got 2 job offers and one will pay 30%, but I pay half the lab bill. The other pays 25%, but I don't pay lab bill. Which one should I take? And I'm like, well, that's the least significant part of the equation. Who would be a mentor to you? I mean, what if one office, the average staff member's been there 7 to 12 years, and then the other office, the average staff member's been there 2 years? I mean, you just want to go sit on some factory and drill, fill, and bill, or do you want to see the big picture?
Right.
Right.
Again, going back to service, going back to communication, going back to building a relationship with people. And when I was in dental school, I worked as a temporary hygienist in many offices, just work on Saturdays before the baby was born, and before Aaron was born. And the nice thing is I got to see a lot of practice styles. And I still use a lot of things that I learned in those days. So, it's so important to keep your eyes open and to find that mentor.
You recently wrote on Sheri Solutions about the new EMV chip card update thing.
Yes.
We used to slide, now there's a chip. Do you think a dental office should, what should a dental office be thinking if they should go from slide to chip or?
I think they definitely should go from slide to chip. I think it's mandated. I think it will be mandated across. I don't know exactly when the actual date of the mandate is, but I do know. I think that it's safer. I think they scramble the number. Unfortunately, what we've learned over the last several weeks is that what really is safe and emails are safe and not safe and things like that. But I think that the credit card company is doing its best to try to prevent fraud in the dental office. And I think that if this is what the government, what the financial world's mandate is, I think we should go along with it. I just feel, and also I think it's something nice that the patients see, because when you go into the grocery store and you're so used to putting the chip card in, and when you go to a grocery store that doesn't take the chip card, you kind of think well, why aren't they up to date? And I know that patients love bells, whistles, wow, all these cool things in the office. The chip card is probably the most innocuous, smallest piece of technology, but it's there. And I think patients understand the security of it. So I would strongly recommend people using the chip card.
I buy all my groceries at the liquor store and they only take cash. So
yeah, well, there's that. Yeah.
I want you to weigh in on something that you can only answer with judgment because you can't see the data. So when you're looking at 211,000 Americans that have an active dental license, and they're young and old and they're urban and they're rural, it's so confusing because the media just made a field day that there's no evidence to support floss. There's a lot of dentists that say, I'm not going to do anything unless it's evidence-based dentistry. And then there's these other people talking about the oral health continuum, and on Dental Town, they'll say, they found P. gingivalis in Alzheimer tissue or pancreatic cancer or this or that. And then other people just say, that's a correlation. That's not a cause effect. That's not evidence. So the problem is we're alive at 2016, not 10,016, when we'll probably know all this stuff. So how does a young mind wrap their head around evidence, oral health continuum, when hell the newspaper is telling you there's not even evidence to prove that flossing works?
Well, as an interesting aside, before I answer that question, I thought that the newspapers did us a phenomenal service because it opened the door for us to be able to have that important conversation about how important flossing or interdental care was with our patients. And I was all over that, and I thought that was such a great thing to do. And that's all we talked about. I mean, talking to strangers on the street, I'm sure that surprises you, Howard, that I would go up to strangers on the street and have a flossing conversation. But we did. I mean, we just talked about it all the time.
Well, you're talking about that. Remember that old quote? I don't care what you say about me, get my name right. If that's what it took to get everyone talking about flossing, good for you.
It was just so important to me that week. I think intuitively dentists do evidence-based, even though they may not stand there and go, oh yeah, I get that, I get that theoretically that there's this oral systemic link. Well, it's not theoretically. Was that old song, the hip bone's connected to this bone and that bone? Well, the teeth have always been in the mouth. And when you do an endo procedure, you are working on the same, blood and lymphatic system that's going through the rest of the body. So I think in our hearts, we know that there is evidence that everything is connected. I just think that people aren't putting that two and two together a lot. I think that we do evidence-based. I think we do evidence-based more on an individual basis than we would do on a generic basis. When you see, as you said, you see somebody that comes in every 6 months and you see the ravages of decay, and then when they start flossing and brushing, there's less decay interproximally, or when they stop drinking the sugar beverages, there's less decay, or when they start hydrating more, there's less decay. I think that we see individual examples of it, but I think that we just see it, we see it and we don't really register it and put it in a scientific package that I really believe. I want to believe that dentists do believe in, in evidence-based. I really, really, really want to believe that. And I heard recently of a patient that had an empyema in the lung, and there was a periodontal bacteria that they plated in that. Well, you can't tell me that the bacteria, and we've known for years that we have to pre-medicate because when you scale on certain patients that, there could be an endocarditis. We know this. So I just think dentists may think they don't understand evidence-based, but they really do.
I think the United States is money's the answer. What's the question? And I think the insurance companies, I think what's going to be the biggest game changer, in my opinion, is the most expensive thing to these insurance companies is a premature baby. And when you have a baby that's 1 pound, and they're directly linking periodontal disease to these preemies. And I know United Concordia is staring at the data daily. It's so huge. And they're starting to realize, my God, if we're providing medical insurance for a pregnant female, we could save millions if we paid for them to get their teeth cleaned and just prevented. I mean, if you just prevented one preemie out of 10, I mean, just think how much money that is. So I think that's going to be the first game changer is pregnant women and gingivitis and peri.
I also know that there's some patients that if you write a letter, or if the physician writes a letter to the benefit company, that they will allow 3 cleanings or maybe 4 cleanings a year, health and wellness visits. We don't want to call them cleanings. We want to call them preventive health and wellness visits. They will allow those and have them covered if a patient has diabetes. So I think there's a tiny window that's opening. I agree with you. But I think that there's, of course, it's all education, and if periodontal disease was fancy and sexy and fun and flashy, more people would do more things about it. But we know.
Yeah. Sheri, I want to ask you back to women's dentist issues. When you and I were little, all the OBGYNs were men.
Yes.
And now they're all women. And
yes.
I don't have the data, but it seems overwhelmingly obvious to me that that's happening in pediatric dentistry.
Yes.
I mean, I don't think I've seen a male graduate in pediatric dentistry in years now. Did pediatric dentistry follow OBGYN to become the first dominant female specialty?
Yes and no. There's a little interesting story there. A lot of the women that graduated before my time, I don't know if you remember Dr. Jane Selby and that era of women, they became pediatric dentists because they figured that that's where, that was the place that they should be, taking care of young children. I think that it's definitely moved to women, and I agree with you. I can't think. I mean, the 2 males that I think of are my senior in years, and I don't know that there's many males in pediatric school at this point. I think it's a great place to be. I think women are naturally the caregivers in the family. I think that women are absolutely the healthcare caregivers of the family. I mean, who's bringing the chicken soup to the kids? So I think it's a great place for women to be. It's also a great place for children to get their first dental experience with a woman practitioner. More like mom, the more homey atmosphere or whatever. I think, look, all my female pediatric friends absolutely rock. I think that first of all, they walk on water. I couldn't do that all day long. I have my small share of pediatric patients, including my lovely granddaughter and my grandson. But when it comes to that all day long, but I think it's great. I think it is an awesome place. Dentistry is an awesome place for women. I don't care if it's pedo. I don't care if it's oral pathology, ortho, oral surgery. It's just an amazing place for women to be right now.
That's who the late Susan Wires, who passed away way too early at UMKC. She's the one who taught me oral surgery, because we're these two big, huge monster oral surgeons, Brett Ferguson and Charlie White, 6 foot, muscular African Americans, bulging muscles, and you'd see their triceps popping out when they're pulling wisdom teeth and all this stuff, and they'd have their all this, and then you'd see this little Susan, and she'd just be, and she would remove them half as much time as big old Charlie and Brett, and I was a freshman thinking, what's going on here? How is that little 120-pound girl doing that without any tricep popping out of her arm? And I remember, and I talked to her, she goes, Howard, it's all leverage. It's all purchase points. And she taught me oral surgery, how to do that. But, another thing I want to ask you, is this a good rap or a bad rap? Practice management consultants report in the field that there are different types of staff management issues when the owner doc is a male or female. What are your thoughts on that? Is that true or false?
Absolutely. You can be anywhere from the scary female boss syndrome to best friend, and being a best friend is not the best place to be. I think men handle the office a little bit differently than they would women. It's, they pretty much delegate a lot of the stuff, and it's a lot of hands off. Women want to be a part. They want to be a part of the community. They also they also just want, they want everybody to succeed. I think that there could be a lot of there's so many points of mentorship. Being a female boss to female team members, I can't even describe all of them, but I think that it's just such a great place to be. Men, I will admit though, the only reason I'm sitting here talking to you is because of a male dentist. I took a job as a dental assistant way back when I was 18. And he pretty much mentored me to go into hygiene and then into dental school. So I think at that time it was because of a man, but I think I don't know that many men that are mentoring a lot of young women, but I think that there are so many women now, and circling back to what you said earlier about your vote and voting for a female to be the next president of this United States, showing that anything is possible. And I do believe that, and I think that that's one of the things that is so great about being a woman in this industry right now. Now, again, you don't want to be the scary boss. You don't want to come in with PMS all the time, and you certainly don't want to be Facebook friends with your team members, because that crosses way too many boards and boundaries. But you come in on Monday morning and you want to show them what you posted on Facebook. That's a different story. It just depends on your relationship with your team. But there's the business Facebook side, and then there's the personal Facebook side, and those never the twain should meet.
Well, I hope there's 2 dentists out there. I have 2 dental assistants that are now dentists. It was funny. One of them, they both had the same thing. They were dental assistants for me, and the biggest problem I had with them is when I'd be trying to do something, their head would be bumping my head away, and other assistants, they're standing back. They're standing back. And I just kept telling him, I said, you want to be in there more than me. And then I started doing more and more expanded duty to even, way too much expanded duty if you're a lawyer. And I just said, you just got to do this. And
Right.
I think they're the two best dentists that I know of. They're just amazing. But for me, and I have no credibility, I have nothing to base this on, but it seems like when I'm sitting around with dentists my age and I hear them complaining about younger female staff management issues, they always roll their eyes and come back and say, well, you can't lead them to battle when you're their friend. You can't go out and drink with them after work. You can't be there. But I mean, you want to go dancing with them, and you want to be their godmother, and you want to invite them over your house, and then you want to do a 180 and tell them to start marching. And so the older guys, but I don't know if that's a Generation Next versus millennial thing. I don't know, but it seems like, I think, to me, it's, you can't get too close as a friend and then also be their tough coach.
No, you can't evaluate somebody that you can't evaluate somebody that you're that close with. It's impossible. And depending on the size of the office, we have a very small office. Depending on the size of the office, I mean, there's definite boundaries. You know, I'm still Dr. Doniger, even though there's a very small office. But and I think that's also a respect thing. I mean, you know, we could sit and talk about recipes, and we can talk about remodeling of houses, and we could talk about real estate, and we could talk about 1,000 other things. But at the end of the day, you know, my assistant is basically giving the schedule to me to the work that I'm going to be doing that's been treatment planned, and I'm going to be working and performing the dentistry. You know, it does, that does stop. It stops right there. You know, we walk out at the end of the day together, and I think my biggest comment would be for any practitioner to remember is to thank their dental assistant and their team numerous times during the day, especially at the end of the day. Thank them when they're walking out. I will not leave my office unless I walk out with my whole team. I feel it's important that the office closes and that's the end. We walk out together. It's just how we've always done it. And I thank them, and I thank everybody that works for me in my office every day, because without the people that are working with me, I can't do what I do. And I don't care if you're a male or a female. I think it's just, you can't do it alone. I mean, there are people that do, but it's better together.
So do you think Jennifer Aniston hurt the reputation of women dentists in the movie Bad Boss?
You know what? Honestly, I don't think that look at every single dentist that's been out there. We've got, the Longest Yard. No, what's that guy? It was filmed in Canada. I can't remember what it was. The other guy from Friends that did every dentist is a caricature on in the movies. Do I think Jennifer Aniston heard it? No, she just put it in a different package that I think, some patients may expect that's what their dentist is supposed to look like when they walk in, and then they come and see me. But
I don't think a dentist has ever been a good. In a movie's ever been a good thing. It's always a joke, a comedy, a horror. An abuser. It's never ever a good thing.
I mean, go back to the original dentist that I think both you and I remember, the first dentist, and that was Marathon Man.
Great movie.
Yeah, it was great, but I can't even sit there and watch that scene.
Oh, that was a great movie. What was that, Dustin Hoffman?
Dustin Hoffman, yeah.
So do you think if women dentists are listening to you right now, do you think they should join the American Association of Women Dentists?
I think everything is a priority. I think if they find that they have time, it's a great area for mentorship and networking. I think if they have time, they should. I think that they should join something. I am a huge believer in community involvement. If it's your dental community or if it's in your local community, I believe that that's something we need to do as a professional. I think that I'm a huge believer in giving back. I served 24 years in my community as an elected official. I'm still serving on committees to this day. I've also found that, when you talk about joining a specific organization, it depends on what phase of life they're in. You just said somebody's coming out with $350,000 worth of debt. Do they really want to have another burden of of a dues and a responsibility. It all depends on where everybody is in their life. AAWD is a great place for women. I think it's a great place for women. But I also feel that if it's not the right time, that they can't commit to being in an organization, there'll be a time coming up soon that they will, and maybe they'll find something else that they want to be a part of outside of dentistry that, you know, serves a similar purpose. But again, I know that I was mentored by so many great women in AAWD. Dr. Jane Selby is one of them. Dr. Jean Furuyama, who's in New York, is another one. I think you're well aware of Dr. Jean Furuyama. Millie Goldstein from Bosworth Corporation. They recently sold their business, but I was pretty much blessed to be affiliated with a lot of really strong women, and just that whole group of Faye Ahlstrom and Jane Selby and Helen Lukauer. They were just great women. They battled to get into dental school, and they fought. They fought the guys that we didn't have to fight, but we still had to fight them a little bit when we were in dental school. So it's nice to have that organization there, and it's nice to know the history of it. It's evolving, and I think that's what everybody is. Everybody is evolving, and if the time is right for them to want to be a member, then that's fine. And if not, there's find a mentor somewhere. That's just the most important thing that I can say to any young woman dentist.
You know, sometimes when you're with women dentists, their husband will come up to you and they'll say that they feel kind of emancipated, that their wife makes so much more money than them. And I always tell them not to think about it while they're vacuuming.
That's true. And my husband proudly wears the dental spouse badge. He's the first person that'll walk up to anybody and say, I'm the dental spouse. And he wears that mantle very well.
That is awesome. Well, hey, I want to thank you seriously for all that you've done for dentistry.
Thank you.
Being the past president, your column, Sheri's Solutions on Dr. Bicuspid. I'm your biggest fan, and I was so tickled that you accepted to be on my show. Thank you so much for spending an hour today with me and my homies.
Well, thank you, and all I could say is go Cubs.
All right, we'll be cheering them on.
Thanks, Howard.
I'll keep my fingers crossed for you.